We are live.
Hello, everybody. Good evening, and welcome you all for another next episode of Gyan Pravah. This is our Fogsi official podcast, and I know the numbers of audience are increasing every time. So, welcome you all, and we are so delighted that you took time to join us. Today, we have the Vice President of Foxy, Dr. Shamil Seth. Dr. Tandulwadkar is away doing some prayers at the Vrindavan temple today, and we have our committee lead, who is Dr. Shamil Seth. He is a very, very enterprising personality. Most of us know how beautifully he has done the recent conference in Calcutta, and there were so many workshops. And I would be delighted to welcome our guest for today, who is Professor Ethan Barnia. He's from US, and he's got loads of number of years behind his whole lineage of 4 decades, I could say, as a board certified practitioner in the REI in USA, and he's got a fantastic hold on more than 7 languages. That is what I know, but today he's going to use English for us. So the format of the show is that Dr. Seth will say a few words about Foxy and to welcome our guest, and then I'll continue with the rest of the moderation. So, Dr. Seth.
Thank you, Anu. Good evening, everybody, and welcome, Dr. Ethan Barnia. Now, this is my privilege and honor to have this podcast on behalf of President Dr. Sunita Tandulwadkar, who could not join because of her pre-scheduled occupation in the offering prayers for all of us in the temple, Vrindavan temple. And what about Foxy? Foxy is an organization of around 48,000 gynecologists members in about 280 societies all over the country. And this podcast is a unique for President Dr. Sunita Tandulwadkar, that each and every committee chairpersons are given so much of importance to hold a podcast. And we are also privileged. We are also having a exposure of all our chairpersons being seen and being shown like this, their activities, they are going ahead with the Foxy and taking Foxy ahead. So this is a unique program. I welcome you all, whoever is watching this program. And the topic today Anu is going to discuss is micronutrients and vitamins for the women. We all know these are required at every stage of development of a woman, be it from childhood, adolescence, then the reproductive period, and even the postmenopausal health. So I believe whoever will be watching and listening to this program will be benefited from the conversations between Anu and Professor Ethan. And we are looking forward to your discussions, Anu. All the best. And once again, welcome, Dr. Ethan Barnia. We are waiting to listen to you. Thank you, Anu.
Thank you, Dr. Seth. And we will now start the moderation of the rest of the podcast. Dr. Eaton, before I start my questions, would you want to say a few words about your previous visits to India, although this podcast is being heard anywhere in the world?
I see. So my exposure to India is going back maybe almost 2.5 decades. And the good thing that I had is to be exposed to many levels of India, from the most sacred temples to Khajuraho, to Agra, to Jodhpur, to Delhi, to Hyderabad, to Mumbai. And what it gave me some sense of that, in one hand, there is a lot of variety, but on the other hand, there is a sense of integration, because the diets in India and exposure to micronutrient, there is a difference between vegetarian and non. And, that is a very important aspect, because the vegetarian has great advantages, but disadvantages versus the other people. So the idea of this podcast may be to give some sense of the commonality that people can share, that good nutrition leads to good health, good pregnancy, and good longevity. So hopefully we can address those issues on a practical level, how to improve for people to get better, and especially women who are really exposed to pregnancy are very important that they have the right nutrition and the right safety for nutrition for a good outcome. We'll be happy to answer some questions.
Yeah. So, Pradeep, we can go ahead with the rest of the show. Thank you, Dr. Said, for joining us at
Thank
a
you,
very
Anu.
short
Thank you.
notice,
Go
I would
ahead.
say. So, very delighted to hear you.
Thank you.
So, Pradeep, I'll moderate now. Uh, yes. So, um, Dr. Barnia, I still remember, I want to go back to our first longest conversation and the first, which was in Hyderabad. And that is the basis of how I thought about doing this interview today and the topic I wanted to cover. I think your depth of knowledge on the understanding of this particular topic is much better than a lot of doctors. Because we have to combine evidence along with the real life wisdom. And what we see, you have practiced over a number of decades, and you've seen thousands of patients through their journeys and their actual experience shared with you, and also some geographical differences that we will come to later. But I want to compartmentalize my questions so that it's easy for us to also understand. So we will divide it into three sections. So I would come to the youngest age group first. So we'll quickly address the adolescent before I will take the longest time for the reproductive age group. So for the younger adolescent age group population, very commonly in India, especially, I would say anemia is very common. But it also just comes with too many other things. It's not enough to just write iron and leave them, because it's, first of all, taking iron itself is not easy. It can have so many implications, constipation and other things. But what would you say that even after, even without testing, we don't want to test and then treat, but as an empirical therapy for an adolescent age group, and then after testing, how would you want to address this age group?
So I think that what happened is that currently there is such a thing, it's called overnutrition. And it
Hmm.
starts on a very young age. And actually, women in the postpubertal age already, their body function is almost like a woman of 34 years because they're so early, they gain so much weight, even on the postpubertal age, that by that time they have efficiency and deficiency in the same time. On one hand, maybe they're a little stronger, but on the
Hmm.
other hand, they don't get the right nutritionists, they don't have the right exposure to food. And therefore, when we speak about the youngest ages, education is key, not the fast food that you can inhale, but the right nutrition, because this will guide you. You know, women live until age 90, 95. So what you treat them and expose them in a younger age serves as a lifetime lesson. What you don't expose them, what is the right nutrition in the young age, it will affect them later on, pregnancy, and after that also their life. Because once the habit is not of good quality, it persists with you all through and it's very difficult to break. And the adolescent age is the most influenceable age, and both mentally and physically. So if you don't give them the right ingredient for feeling that my life is long term and therefore I have to start taking care of myself in the earliest age, then it's very difficult to reverse it. And we see already women in age 20, 22 who have weight of 100 kilogram, 120 kilogram. What happened? Because, I grew up and therefore my exposure was to fast food. So the change of fast food for the real food is very uh, critical as the other part of the age. We need to educate that you need to have the right amount of food and not excess food. And especially in countries when there is not access to high quality food, the fast food is very accessible. And when that happened, is actually it become the habit and very difficult to break.
That's very true. So when we come to the this is very interesting actually. You immediately highlighted to overnutrition when we are talking about this concern, which is so appropriate for this age group. But would you want to, for example, is there like a typical empirical therapy of would you want to write any prescription for over-the-counter vitamins or micronutrients for this age group? Do they we are they good enough to go for just empirical supplements? And what would that be?
Yes. So if we speak about supplement, nutrients, food items give the best
Hmm.
for it is. So, for example, if you look on somebody's eyes and if it's white, you know that they're anemic. So right away, you don't need a test. You can know if there is anemia or not, and especially vegetarian many times relates to anemia. So very easily you see and you act, even you don't need a blood test to do so. There's
Yeah.
certain things are very fast. Second, level of energy and activity tells you that you're really near. The basic idea, if you have the right food items from earliest age, the required for supplement, it's called add-on, not instead of. People getting, and second is access in certain countries is difficult in certain region, because it costs money to find it. And then the question is whether you're getting the right supplement of good quality, because there's so many generic instead of being of high quality. So
Yeah.
even let's say if you talk about prenatal vitamins, you have to really make sure that you're looking it on the right one. Is it really has the right ingredient
Yeah.
or not? So access, it doesn't mean quality. With the food items, what you eat, the right thing, the right proportion, gives you the most nutrient. Of course, as you go to preconception and pregnancy, supplements are required, and we
Yeah.
can discuss about it. But I think that in the younger age, instead of considering supplement, the right nutrition builds your right microbiome and gives you general health and keeps you not to develop polycystic ovary and obesity and many other from the youngest age.
Yeah. So now that we've already touched upon the prenatal, I actually now want to divide the reproductive age group into three different parts itself.
Yes,
So the first would be an early reproductive age group when somebody is just entering into early adulthood, but they're not trying to conceive for the next few years. So this
correct,
would be the first. And then after that, we'll come to prenatal pregnancy. And then
correct.
immediately after pregnancy, till the time which is like average age of menopause in UK is 51. So we'll talk about, say, for example, the last decade of 40s up to 51. So coming to the first section of reproductive age group, what are the supplements you think we must write to the patient?
I think that the way to look at it, and we can divide it into less than 18-year-old, and then the next pregnant patient we're looking forward after 18. The adolescent is a formative time. And actually, if we speak about it, what are the recommended? Is calcium, some iron, some folate, vitamin A, B, C, and zinc. That would be the kind of the suggested exposure to people. I think that the zinc is very important, and also considering now vitamin D. Those two things actually were protecting against COVID and multiple conditions, medical conditions, because when your vitamin D is really low, you're much more prone to autoimmunity condition. And zinc is a protector actually against COVID, which have been shown. So people who have polymorphism of vitamin D, much more sick for COVID. And, we have COVID, although it kind of calming it down, but there is still infection. So if we want to protect population in the younger age. So as I mentioned, is calcium is very important because young women, their bones develop. Post-pubertally, they grow, and therefore the bone has to be supported by the muscle. So calcium is a very important element, and especially if people are more athletic, etc., so the requirement is even stronger. For iron, as I mentioned, is very common to be, because if you don't have the right balanced diet, you can very easily become anemic, and then you can diagnose. And then comes the folate and vitamin A and B and C. Those are mini ingredients that if you take one pill, which encompasses, and you don't have to take six implant, you can have one or two of them to cover the field. And what happens then when we speak about prenatal vitamins, the prenatal vitamin is supposed to contain all these ingredients in one shot. You don't have to take six pills, because also compliance is very important.
So I would want to add some points here for the viewers that when we say calcium, it's probably better to take a empty stomach, and when we say D, it's better to take with K2. Am I right? So
Yes,
so D3 these days, the combination with K2, that is better than taking D3 alone. And I always
correct.
tell my patients to take it with the fat soluble, either milk or just a combination of an omega-3 capsule or some fat soluble, because it won't absorb otherwise. And then half an hour later, it's good to do some exercise so that fat actually gets the circulation, because it won't
Right.
absorb otherwise. So
That is
calcium,
correct.
vitamin D, yeah, they are better taken empty stomach with with the fat soluble, and D better be combined with K2.
Yeah.
So these are,
For iron, just sorry, is that much more better to take it with some orange juice, because
yeah,
otherwise the absorption
vitamin
is
C.
much better unless
Yeah,
never to take it with milk or milk product, because it will
yeah,
stay in the stomach. And therefore, iron is really, people do not want to take it because of the side effect that it causes.
yeah,
So if you change the iron to 2 to 3, you create an environment is much better absorbable. With some orange juice, that is a very important way to do. It's changing a little the acidity of the stomach, and it
yeah.
absorbs much better.
And the whole
Zinc, there is no
culture,
problem.
and the
Pardon
whole
me?
culture, which is British culture and Indian culture, is to immediately after the meal we take a cup of tea, and which is so wrong because tannins won't let the iron absorb. It's like putting a curtain on the tummy. So we do read that, but we always have to tell this to the patients that it's healthier to take an orange juice rather than a cup of tea afterwards,
Correct. I think it's
or
very
with
important for absorption, because you see, if you take something, you want to say, look, I really have to take it, but I really don't want to take it. You know the difference? There's
yeah.
a
So
resistance.
this
Yeah,
is very,
although the
very
doctor
correct.
told me, but I won't do it because, I cannot tolerate.
I
There is
know it's
also
so
something
cultural.
gummies. There are some gummies that people say that come maybe easier to absorb with iron than pill itself,
Somehow,
And
I
another
think,
one,
yeah, I have been discouraging gummies to all my patients because of the background jellies, sugar content, and preservatives, and
correct.
it's so unhealthy on the face of it that even if you put something nice in it, it can't still be prescribed. So gummies are not something that I generally ask my
Correct. No,
patients.
no,
Yeah,
but some people do not tolerate. The other thing is,
yeah,
instead of
yeah.
sulfate, it's better fumarate.
Yes.
Ferrous
I was
fumarate, it
actually
seems to be
then
better
coming.
absorbed.
Yeah, this reminds me of magnesium. I want you to tell me about the role of magnesium in reproductive age group women, please.
Yeah, so there are different type of magnesium. The
Yeah,
magnesium oxide will be, if you take it in the evening, you will have improving sleeping. If you take other type of magnesium, it actually will wake you up and give you more energy, and it will work you for improve uh, cognition. But the magnesium oxide, that has been shown to do. So we have to be also very careful, because if you look at the magnesium, there's sometimes magnesium it's written, it will make you more energy, etc. And indeed will be more difficult to sleep because it's done for daytime. The magnesium oxide is really good for the time that a person needs to do. And so we have to be aware, because not all magnesium are equal. So just
yeah.
to keep it in mind.
My dietitian says about glycinate. So what is that not better than oxide?
The oxide is for sleeping.
Hmm.
There is other thionate, for example, much better for memory improvement and focus. So there are different, and therefore, you can see it very clearly when you look at the bottle, what is written, more energy, more focus. At night, you don't need it. So you want to have exactly the opposite. So be careful when you take magnesium that you take the right magnesium for the right reason.
So for like a typical, now we come to the next, which is somebody who's trying to get pregnant now. So prenatal side.
Yes.
So if somebody is now these days trying to conceive, what would your advice list look like when it comes to vitamins and nutrition, micronutrients?
So I think that the most important thing is called adaptation to pregnancy. What I mean is like this. If you have any issue like related digestion or etc., you must address it before because as comes pregnancy, your ability to consume food changes, especially in the first trimester. So any problem prior GI tract, etc., should be addressed clearly. Number two, I think that since you know your weight before, your BMI should dictate how much you need to gain weight during pregnancy. And the amount of weight gain is very important because it's associated with good pregnancy outcome. So if you have really a very lean, you'll have a baby with growth retardation. If you have an over, you're more likely to have diabetes, hypertension, and all the other risks. So you have to know, based on your BMI, and probably different ethnic group is different, that your BMI is very much related to preconception and pregnancy. And you need to have that golden balance because if you're really very high BMI, the amount of gain in pregnancy should be limited compared to somebody who is really underweight, who need to have much more. And once you have that defined, and I think that BMI is a very standard way to define, then you should be able to know the amount of nutrient you will need also during pregnancy to accommodate to do. Standard is prenatal vitamins. Standard is to make sure the food is safe. Standard three that you're going to do that your microbiome is adjusted for pregnancy because if you have some GI, if you have gastrointestinal problem, pregnancy will aggravate it. So those things are very important that smoking, alcohol, those are also exposure that you want to minimize. So the preconception should be a period of reflection. What do you want to achieve? And if you minimize those risks, you achieve a better pregnancy outcome because you are ready to do a little limitation of maybe your habits in order to have good for your mother and baby outcome. So since today pregnancy is really a rarity so much, not so much a commonality, each pregnancy counts. And therefore, if you do the right effort to do the right thing prior and with reflection of you as a person, then you take responsibility to two people because in the end, it's not only you, but also the baby. So you have a double responsibility for a good pregnancy. You limit yourself in order to have a good outcome for both parties.
Yeah, very, very true. So, when it comes to micronutrients, apart from zinc, do you want to speak about some other
Yeah.
micronutrients?
So I think that the standard is of think about like this: a good prenatal vitamin should contain most of the ingredient, and therefore, because also people to take multiple items during pregnancy, they're more difficult to digest. Each pill you take, how can I absorb it?
Yeah,
So
so
one
because there are
one
so
item.
many on the shelves of pharmacies, what are the minimum when somebody is comparing? What is that? What would you say that, okay, look for the ingredients, they must have these four or five when you're trying to conceive? Is there a list that you would want to share?
There is a list. You say calcium, for example, you want maybe 800 milligram, iron low 22 milligram, except for anemia. But certain age environment, the anemia is very significant. So we need not only prenatal vitamin, but also some ferrous fumarate to add into it because there's a very big commonality of having anemia I see in my patient because of poor nutrient encounter. The other one is folate, of course, because neural tube defect, critical to do, and that should be around 400 to 500. Vitamin A, which should be, again, should be around 500. Vitamin B, a low number, and vitamin C also low number, and zinc. So those are the really standard recommendation. And when somebody compares prenatal vitamins, should look whether those numbers fit into what they do. And second, that the prenatal vitamin is easily to absorb, because if it stays in your stomach, it does not really to do. So make sure that it is maybe something more a capsule than a pill, for example. Those things are easier to absorb than a pill, which is hard and it takes a long time to digest. And especially if the person is pregnant, very easy can a nauseous feeling not to be absorbing it, especially in first trimester. So the capsule is much more gentle to the stomach than a pill itself for absorption.
Yeah, that's very, very interesting. And these days we have further different formulations like nanoparticles of vitamin D and everything, but that is specially separated out for somebody who's really documented a deficiency for the same.
Yeah, so vitamin D is more a limited use, but today, because of told you that infectious diseases, etc., it would be recommended that we'll add into the armamentarium to make
Yeah.
sure you have enough level of vitamin D in circulation. Because I see patients who should be a level of 30 and they have level of 5. So clearly they are much more prone, possibly for immune and infectious diseases. So vitamin D is a very essential element in it.
Now we want to go ahead and talk about the postmenopausal age group. And I am very aware that you have read a lot for you as a couple with your wife, and you have designed your personal routine. Please go ahead and even share that if you don't mind.
Yeah, so
Yeah.
I think that the most important to realize there is no menopause. It should be called a transition.
Yeah.
Because, what you do, you got menopause, you sit down and said, okay, my life is done, I'm sitting in menopause. No, the second point, which is very important to realize, women can show this transition after age, even at age 35. Now we find it is earlier and earlier, they are already going through this semi-transition. And what is important to women to recognize it? Because women are strong and they believe I can handle it. But vaginal dryness, difficulty sleeping, in memory or anxiety, all this, many times is related to the hormonal changes, which can be subtle. So the earlier they identify those, the earlier they deal with it, the less really they have hardship, because all the time I can deal with it, but actually you do not deal. So already in age 35, 40, 42, etc., those things quite common. Once you recognize it, then you become a smooth transition. Number two, what has been shown very clearly, that estrogen exposure, at least age 50, prevents mortality. So any woman who has a little lower female hormone environment, etc., should benefit until age 50 because it prevents mortality. We speak about real hardcore. Estrogen is essential until age 50.
Yeah.
So if you don't have enough, you are much more prone to shorter lifespan. And that is
I think
interesting.
it's
That
directly related to the cardioprotective and the osteoprotective.
100%, 100%.
So
And
bone health is so crucial to the longevity, isn't it? So especially
no
when,
question. No, and
especially the femur, especially the long bones of the thighs are recently there. I have gone through some good quality studies, not very powerful, but reasonably good quality studies in which they said that if you have stronger legs, you live longer. But I don't want to make a statement on that. But it's
no,
just indirectly, what we're trying to say is that bone health and cardioprotective nature of estrogen as the this is so crucial, and that's why when we do surgeries, please, please, please don't remove ovaries even up to 93 years of age, is what I would
Correct.
want to say to anybody who's listening, who's very aggressive surgeon. Please leave the ovaries there. They do have a job till the end of
And
life.
yeah, there's one more thing that is important. It is that I find already women age 35 have osteopenia.
Yeah. See?
Very easily they have osteopenia already in age 35, 30. Because if the transition is happening, it creates multiple facets. The
Hmm.
estrogen deprivation affect the bone, affect the muscle, affect the memory. So since women in age 30 have another 60 years to live, they should change the mindset. There is no more the word menopause. Nobody should have a menopause. Somebody should have a good transition to the next phase of life. And then the decision whether they need hormonal replacement, I think, is today more advocated than before.
Yeah.
There was before that you die from breast cancer. It is not true. Today there are also estrogens which are on the skin, transdermal. There is now speaking about E4, that it's not E3 that could be helping, which is more plant-based. So women should be open to the idea that there is not a period that they should feel bad about themselves. It's something that should empower themselves to do better.
Great. So, this is a very crucial message of the whole podcast today, actually. And we will be addressing the HRT in a separate podcast. I'm trying to organize that also. So, we'll go into that HRT detail in the upcoming episodes. But you won't even imagine half an hour is already up. So, we
Yeah.
are very close, but I'll take a few more minutes with you to just share your thoughts regarding, yeah, like I mentioned, would you want to share the routine that you practice as a couple? Like, what are the standard things that you take from morning till the night? And I'm not asking the audience to copy that because everybody is different, but just to understand how he has gathered his wisdom and understanding around it.
Yeah, I think that the most important thing is that we look at phases of life, and I think there is now more and more evidence that it's physiology, not chronology.
Yeah.
That's the most key element it is, because somebody said, I reach a certain age, or therefore my expectation for myself is to be this way because this is my age. I think that has to be very, and has been recognized in medicine, that physiology what counts. And if you think that your physiology is right, your
Hmm.
chronology does not matter at all, because what it means that you live your life on a very productive way without thinking, because of my age and somebody told me because of my age, etc. That is wrong. The second thing is that the way to look at it, for example, with women is that using calcium, using vitamin D, because very easily when you have tendency for osteopenia, you need vitamin D
Hmm.
and you need calcium. Those are two essential elements. And then you should also consider whether people need maybe an earlier bone density test to verify. Because once you are aware of a condition, you're trying to improve. And now then we speak about your health. In general, the less is more. The less medication you take is much better. We should go back a little to a Chinese thought that if you're healthy, the doctor should be paid. If you're sick,
Yeah.
that means you did something wrong. So I
Maybe,
think that
maybe you should elaborate a little bit so for the audience what you're trying to say, because I know you told me this, but you can just elaborate that.
so the basic idea is that you want to prevent health issue instead of need to go to the doctor when you're sick.
Yeah.
That is a basic idea. So as a person in any age group, you should take the responsibility of your health, and you should consult the doctor when you feel that you on your own you could not do. And that it comes to that, what are the things that you can take to minimize maybe. We spoke about calcium, spoke about vitamin D. Do you need anything for cognition? Do you feel it is, like focus factor, etc.? Some people need, some people don't, but this is self-driven.
Yeah.
Do you sleep well at night? Because if you don't sleep at night, you don't function right in the morning. So you have to make your life habits 3 meals a day, sleeping in the right time, you know, don't to do multitasking. The worst thing is people do is multitasking. I talk to the podcast, I look in the TV meanwhile, and I read my cell phone. And that what happened is that you losing concentration and you do many things bad instead of doing, even if it take you 2 minutes, you must be focusing what you do. And therefore you can accomplish things, because otherwise you're losing, you try to do many things and you fail. And I see people doing 5 things at the same time, and then they don't do it right. So busy people have time, and it's very important that if you dedicate to an item, you accomplish. And then finally, some supplement that you consider to do. Zinc is a good one
Yeah.
because it prevents disease. Vitamin D, etc. Glucosamine chondroitin, it's a good one, especially with joint discomfort. So there are certain things that you can do that can help your health to minimize the need and to do good quality exercise, not overdoing it, and the right nutrition. 3 meals a day, morning more, lunch decent, dinner, last meal should be around 6:30, 7 in the evening. No midnight snacks, period. And therefore, if you look at that Mediterranean style diet, you have that if you have 14, 16 hours between one meal and the other, in the evening, you really improve your overall body health.
Yeah, I mean, the Nobel Prize is given on this autophagy concept recently, so I think I'm talking to those audience, so most of them would be aware of autophagy concept. There is so much to talk on this subject. We can never complete things in
Correct.
30 minutes. We try to roughly just umbrella term some of the important things in the episode, but there is something more deeper that I think we will design in the future podcasts with the specialist on HRT, and we'll address into those matters. But to summarize for today, it is very important to understand that everybody is different, and there is a scope to cover Ayurvedic products. Nothing against them, but only if you know the full spectrum of how they work and the side effects, and whether they are appropriate and really needed in your case or not. So cognition, like you mentioned, there are some very famous products in some alternative medicines, but not in the main, our kind of very evidence-based therapies would not have enough evidence backing any of the things. But when it comes to a specific thing like cognition, for example, I would mention ashwagandha is very popular and gaining a lot of evidence for that reason. But we are not against one type of medicine or the alternative therapies. Um, as long as you know the whole profile of what your body needs and what you're taking, that is the key message. um, Less is more. These days there are some very popular products with almost zero evidence behind that, and I know that people would be waiting for us to talk about some IV therapies, but I'm not going to talk about them because there's no end. If I start, I need at least 1 hour to talk about them. The NAD drips and all those IV drips, that I'm actually sitting in a place where right now at least 15 centers within the half-kilometer radius is we have 15 centers doing just IV therapies, and people are paying a lot of money for that. And these days we have those people who have teams who go to their houses, and it's like IV therapy party, and people are just sitting in their house and nurses are standing next to them with the IV lines. This is something we are going beyond the evidence, far beyond the evidence. So rather than talking about it, I just want to highlight that as long as you understand an individual body and only design less around it, that is more. So thank you very much. Do you want to say anything to conclude?
Yeah, first of all, thank you for the opportunity. I think that the most important that each person should take their own responsibility. That's the most important. And the decision in life should be made from earlier stages, not to try to repair after damage is happening, because very easily we're influenced by environment which really do not, each has to maintain his own individuality. And if you have it for young age, that self responsibility, it will carry you for a long time, not to fall on the wayside. And younger people should have that, not the TikTok and Instagram, etc., but to look at themselves instead of all the time. But they did it, therefore I have to do that. Very carefully, you have to judge what you do to maintain your health. So your health is in your hand. Keep it.
Absolutely. Thank you very much. And we wanted to put a little introduction to this topic because every 29th, I will now be focusing the podcast on individual issues and call the individual specialists on that. But it was great to start this new topic with Dr. Barnia because I know the overarching wisdom around this topic is huge. But we are being careful about what we say because everything we say should be backed by evidence. So thank you very
100%.
much. Thank you very much for your time today, and thank you for all the audience to have joined today. And we sign off for today now. Thank you.
And thank you for the opportunity. Thank you, everybody. Thank you.